today we're going to have two people speaking. The first is Dr. Louis Voigt. He is the chair of the ethics committee at Memorial Sloan Kettering Cancer Center. He is a physician in the Department of Anesthesiology and Critical Care Medicine. He's on the Critical Care Medicine Service, so he works in the intensive care unit. They call him an intensivist. And that's a very stressful environment. It can be very overwhelming for patients. And one of the many wonderful things about Dr. Voigt is that he takes care of the patients not just in body, but also in mind and in spirit. And leading the discussion with him, we're delighted to have Nessa Coyle, who's a nurse practitioner who has a PhD in nursing. She has been at MSK for many years and has followed the change in palliative medicine and palliative care over the time that she's been here. She's also a member of the ethics committee and works closely with Dr. Voigt. And so without further ado, I am delighted to present to you Dr. Voigt.
Thank you. Thanks, Laura, for inviting Nessa and I to this symposium. It's an important topic that is dear to a lot of us. If I may, can I ask a few of you, and you can raise your hand, what do you think bioethics is? Go ahead. I'm sorry, whether it's about?
So ethical issues in medicine, well, I know some of the ones that I read about in class are in terms of physician-assisted suicide or what to do when a patient is not able to give consent to treatment, and how do you decide how to move forward.
Okay. Anybody else want to add to that? I know that some of you may be here with your dad and your mom and other guardians and parents. I told them they need to give you a break tonight. So feel free to express yourself. Go ahead.
All right. So I believe that bioethics is looking at biology, biological sciences, anything having to do with organisms on an ethical standpoint. So you can look at it through generally bioethics or medical ethics, having mostly to do with medicine and how you handle the human body. Some examples of this that come to mind is the concept of like 3-parent embryos with mitochondrial transplants and things like that. So, yeah.
Wow, impressive. Anybody else want to? I will take one last person. I need a brave volunteer in the back.
I think it mostly pertains to what the right or wrong thing is to do surrounding medical treatments, and as someone else said, the organisms in general, and the morals surrounding that. Yeah.
Very good. I don't have to, I can go home. So let me tell you what we know. Throughout history, human beings have faced a lot of challenges. And as you know, the society, even in today's society, human beings are still plagued with illnesses, but they are also plagued with wars. Even within your own community and within your own school, some of you like this person and you don't like that person for whatever reason. So if you magnify that, we have had a lot of challenges in the way we interact with each other. Fortunately for all of us, as people reflect on those differences and also on the similarities between different individuals, there have been a lot of people who put those reflections into concepts. And one of these concepts so some of these concepts were transmitted through time to a variety of vehicles. And one of them is religion. The other one is philosophy. Another one is moral reasoning. And you can add to that list, because there are a lot of things that human beings, when they face crisis and they realize that they need to evolve and they gain more and more knowledge and wisdom, then that maturity to our own evolution as human species leads to us understanding what you alluded to in the back. We come to a consensus about what we consider to be wrong and what we consider to be right. And regardless of the society where you live or the country, there are some commonality among countries as to what is viewed as wrong, as is what is viewed as right. For example, we know that no matter which country you live in, no one wants to harm a pregnant woman or a baby. So we can accept that. So in essence, that theme of morality and humanism came from a variety of people, and some of you may have heard of them, some of you may have never heard of them, but these people shape, and they come from different societies and different countries. They shape the way we view ourselves as individuals, with rights, with what we expect to receive from other human beings, and particularly with what we expect to receive as individuals with unique features, unique characteristics. And the history of these influential thinkers has made a big impact on bioethics. And yet, if you look at all of them, except for two of them among the Greek philosophers, most of them were not physicians. Push it forward, in the past 2 centuries, you have had a bunch of other individuals within the profession of nursing, for example. And I'm thinking about Cicely Saunders or Virginia Anderson, who had made also a big impact on the way we treat patients, so that we empower these patients so that they can feel comfortable in claiming their rights. And that's what bioethics try to be. So each one of you has your own likes and dislikes. Each one of you has your family, and your family has certain preferences. Also, each one of you live within a community, and that community may be an ethnic or religious community, or it may be a community of atheists. You don't believe in anything. Each one of you also live in a country or in a state where there are some legal standards. So if you put all this in a melting pot, what comes out is what bioethics is about. So I try to simplify it very clearly for all of you so that you understand as we move forward with more complex concept. So bioethics is a tiny discipline in healthcare sciences that teaches individuals to address moral challenges that may come and may occur during the delivery of medical care to patients. So that medical care can be conventional. This is something that everybody accepts. For example, if you have an infection, we give you antibiotics. It could also be experimental. You are enrolled into a clinical trial to test one medication versus another. And bioethics bridges the gap between what we consider to be customary or standard practice and unusual practices. And it also helps patients challenge their physicians and nurses into stepping outside of what they consider to be familiar and considering what could be considered to be unorthodox. And I can give you the perfect example, is that for a century, we knew that if somebody is going for surgery and you are bleeding during surgery, you would need blood transfusion. Come the community with that faith called Jehovah's Witness, and they said, we don't want blood transfusion because we view blood transfusion in our own interpretation of the Bible as Christian to be the soul of the body, and God forbid it. That's the way they interpret the scripture. As a result of that, they challenged the medical community to care for them without giving them blood transfusion. And guess what? Some groups of within the medical community embraced that challenge, and we have currently a lot of surgeries being done not only on Jehovah's Witnesses, but on people who are not Jehovah's Witnesses, and they are called bloodless surgery. And they need to be given credit for challenging the familiar and the orthodox. So there are 4 principles of bioethics, and I'm going to stop toward the 4th one to give you my own bias. So we have autonomy, we have beneficence, we have non-maleficence, and we have justice. The first 3 are real, and we practice that on a regular basis 99% of the time in the United States. Justice is a utopia. We do not practice just medical care in America. That's my bias. Because if you are poor, you are healthcare illiterate, you do not know a lot about healthcare, your care may be affected by that. If you go to certain countries in Europe, if you need an operation, you do not have to worry about it. There are patients coming to Memorial Sloan Kettering to receive their cancer care. At the end of their cancer care, some of these families are bankrupt because it is extremely expensive. And I can give you a perfect example. There is a treatment now approved for children with leukemia. They call it CAR T cells. You can Google it. CAR as C-A-R, T cells. It costs approximately $150,000 to $200,000. And the cure rate is high. In fact, the first kid who received that treatment at University of Pennsylvania, she was, I think, 8 or 9 years old. She's currently a teenager thinking about going to college. But guess what? Not every family would be able to afford $200,000 of treatment. In Canada, they are sending kids to the United States to receive that treatment, and the government is responsible for that. So you, as young people living in this society, you are the leaders of tomorrow. This is something that you're going to have to try to face and address. So what is autonomy? Autonomy is what makes you unique. It's your ability to make choices and take actions based on your own personal values and belief. So that's what autonomy is. And physicians and nurses and other healthcare professionals are supposed to respect autonomy by acknowledging the patient's right. And in fact, whenever somebody gets admitted to the hospital, we give them what we call a Bill of Rights so that they know what they're entitled to, what they're supposed to receive as care. They're supposed to receive compassionate care with respect, with dignity, that teaches that the staff will also be confidential. We don't go and start gossiping about patients in the hospital. It's inappropriate, it's unprofessional. Also, respecting autonomy means that we as physicians and nurses and others need to empower you, because the reality is, when you look at a physician and a patient, that relationship is not on equal footing. The physician is here, the patient is there. So respecting autonomy means you try to lift up the patient and you try to lower the physician so that they can be at the same level. You're going to say something?
Yeah, just one aspect of that is that to be able to practice autonomy, you need information, and you need information in a truthful, honest way about what your particular illness is and what your options are and choices are, and the benefits and the burdens of each. Because if you don't have that information, how can you choose what you want? So getting that information about your medical history, your medical disease, and what the treatment options are is incredibly important.
Thank you. So patient needs to understand the information provided, act with the intention that they want to get better, but also we shouldn't try to influence them. So when we're giving patients that information, we don't tell them, you should do this, you shouldn't be doing that. They can ask us for our opinion. What do you think you would recommend? We can make recommendation, but we try to be very balanced in offering a variety of options in terms of whether it's a procedure that they need to go for or whether it's a medication that they need to receive. Sometimes we tell them there are no other alternatives. So, and you can choose between one versus the other. I'm sorry. Non-maleficence, the second principle, is what is embedded in the Hippocrates Oath, where you try not to harm your patients. And you tell your patients about the risk and the benefits. And you tell your patients the reason that we do not recommend this is because this could cause you more harm than good. So you try to empower them and you explain to them in better terms. Beneficence is somewhat similar to what you expect from your parents. So, or your guardians. Each one of you sitting here, do not expect your parents to mistreat you. Do not expect your parent to say, we are not going to give you an education. You expect your parents to love you, to try to help you to move forward. So that's what physicians try to do. Nurses, respiratory therapists, physical therapists, when they come to you, it's the same way. Some of you, when you were 8 years old, 9 years old, it's snowing, and you said, wow, great snow day. And your mom said, no, you're going to school. Why? Because she knows better. So the fact of the matter is, physicians the same. We tell you, quit smoking, don't drink, do this, do that, exercise, watch what you eat. The reason that we are promoting that is because there are benefits in that. So we on your side when we tell you, and sometimes it's hard. When the physical therapist come and said, we're going to do some exercise today, and I need you to walk 50 feet, and you said, I'm weak, I had major surgery, I cannot do it, we will help you. That's beneficence. So it is not something that is limited to doctors and nurses. There are a bunch of other people who are doing that as well. And they're trying to do good, and the reason for that is because they have an obligation to provide that care. Otherwise, you could go to anybody. And then justice is to treat every single patient equally and to make sure that resources are fairly distributed and allocated. And that's where we get into trouble. Because if you look at rural America versus the big cities, there are already differences. I had a friend of mine who was one of 2 obstetric GYN working in West Virginia in a 200 miles radius. There was nobody else. The only group of people who were taking care of pregnant women were nurse practitioners. In the meantime, if you come to New York City, you have them at every corner. So you go to West Virginia or to some other towns in the middle of the country, you don't have a lot of hospital. People have to travel 100 miles to get to the nearest hospital. You come to New York City, you have one every corner. Although lately, downtown Manhattan doesn't have that many hospitals anymore. So if you live there, that's a problem. So, but that's what happens. So that's the reason. And then if you get into a patient being admitted, in fact, there are countless articles in the New York Times showing that if you're a black woman who is pregnant, regardless of your education, you do worse than a white woman who is pregnant in America. So it has nothing to do with wealth or education, just your race. Put you on a different pathway. You have higher mortality in everything. So that's the reason we need to fix that problem. If you want to build a hospital or open a clinic in Switzerland, the government has to approve it, not here. So that's the problem that we have. It's not equitable. So ethics of professions is what we alluded to in beneficence. every single person working in a hospital take an oath so that they can work to the benefits of patients. They also must demonstrate competence. Because if I'm sick, I don't want any one of you, if you are sick, you don't want somebody who doesn't know what they're doing to take care of you. They're supposed to put an IV, and then next thing you know, your arm is all swollen. How would you feel? So that's the reason they have a lot of responsibility, professional responsibility. There is something called, it's a big word, fiduciary responsibility. I'm giving you a couple of big words. You can write them. You can take them home and use them in class tomorrow. It is to protect the interest and to promote health. You tell people exercise, what you eat more vegetable and all of that. Virtue of fidelity, it's when you take the patient interest ahead of yourself. And I can tell you countless of colleagues of mine that I know in pediatrics and in adults who do that here at Memorial. I'm not going to be talking about myself. Prior to coming to Memorial, I had a life. I work with a bunch of other non-governmental organizations. But there are people here at Memorial who embody that spirit of virtue of fidelity. They would come at 2 o'clock in the morning. They would console. In fact, I see a couple of my colleagues in the audience who have been practicing that way. They would help patients. They would help families. I saw one day an attending physician who left home to come on New Year's Eve, December 31st. I was a fellow here because there was a patient who was here alone. And she spent New Year's Eve with that patient from 10 o'clock until 1 o'clock in the morning. So there are a lot of angels in this hospital. And you don't have to go and give somebody $50,000 to do right, to do virtue of fidelity. Some of you who are sitting here, you should come and volunteer here because there are a lot of patients. I had 2 kids. They're now in law school. But when they were your age, I told them it's not a choice. I didn't give them autonomy. And they came here to volunteer, and they realized the value of that. And they came to understand that there are a lot of goods that they can do without raising money. A lot of people, we live in a society where we focus so much on money and material things. There are a lot of things that you may not realize that are within your reach that you can do to help somebody else. I'm inviting you to embrace that. So why is bioethics important? So there is a professor, I think he was at Georgetown, I don't know where he's at now, Paul Lombardo, who spoke about a beautiful book that traced the history of eugenics in America and gave the case of a young woman who was asked to be undergoing forced sterilization because the Supreme Court of the United States considered her to be an imbecile and essentially said in their decision that they didn't want 3 generations of imbeciles that would be, that the Society of Virginia would have to support. Similarly, some of you may never heard of that name, and I would invite you to forget his name. Mengele was interested into experimenting on Jewish twins. And he works in Auschwitz. I have been to Auschwitz, and I can tell you, it is terrifying. So I'm not a Jewish, although I claim from time to time to be of Jewish descent, but I am not. But suffice it to say, when I went there, I was humbled by that experience. Similarly, in the Tuskegee syphilis study, there was a group of physicians and nurses who enrolled 600 African American men in the South who were working in the farms, in the field. And they promised them that the study would be over 6 months. They had 400 of them that they injected with the syphilis bacteria, 200 without. In 1940, the study started in 1932. It should have finished in 1933. In 1947, Fleming, a British physician and scientist, discovered penicillin and showed that it could treat syphilis. They continued the study for 40 years until 1972.
What's terrifying about that to me is that I started working here at the end of 1969. And so this experiment was still going on.
Yeah.
So that's pretty terrifying.
So that's why bioethics is important, because sometimes healthcare providers lose their way or they feel like they're on a tightrope. The bioethics people can offer you that safety net and essentially allows you, if you reach out to them, because they may not know if you don't know what you're doing, they can offer you that safety net and tell you, perhaps you may want to think about it differently. So how do they do that? They do it through the process of consultation and education by involving a variety of parties who may disagree about the best thing to do. And they facilitate discussions where they take different opinions and point of view. They look at risk, benefits, goals of care, and they mediate and they help. One of the things that I tell every single medical student and resident and fellows, I give a lecture on communication, I tell them all the time, you have 2 ears and 1 mouth. Use them in that ratio. Do twice listening, once talking. So, Nessa?
So this is the first case. And see what you think and how you ought to respond if you were an ethics consultant and you were presented with this situation. So there's a mother and her 13-year-old daughter are admitted to the hospital after a car accident. They are bleeding, and the trauma surgeon needs to stop the bleeding from a lacerated spleen, which is very, very, it really bleeds a tremendous amount. A document indicates that the mother is Jehovah's Witness, and if you're a Jehovah's Witness, as Louis said, that you don't accept blood transfusions because the thought is that it will, in a way, damn you for your future life after life here.
So what would you do? Scenario 1.
So should the surgeons and nurses transfuse blood, and if so, to whom? The mother only, the daughter only, or the mother and the daughter? So what do you think?
So we have 2 microphones. This is your time to talk now. And then we have 2 microphones portable in the back.
And I just have a word of caution that the cases that we're presenting, some of you in the audience may have had that experience. So just beware of that if you have had this experience and if you're upset by it, we're here to help you.
I like it. They're talking. May I say something? What all of you are doing there is remarkable, because what I didn't tell you in the presentation, and it is really speaks volume of how perspicacious you guys are. Ethics does not go, an ethics consultant does not go into any of these cases alone. You know what they do? They talk to each other. And that's exactly what you're doing. Because it is a big burden to make that decision on your own. So what you do, you gather a group of people and you said, what would you do in that case? So and that's exactly what you are doing. Continue. So, all right, so time for debate is over. We're going to start getting some of the opinions in the audience. We have one person here. I'm inviting you to go to that microphone so that you would be second. Oh, I'm sorry. So I'll give you my microphones. So go ahead. You can start.
It is? Oh, yeah, okay, yeah.
So go ahead.
Okay. So in this scenario, I would assume that since the mother is a Jehovah's Witness, that her daughter follows the same religion, and though even if she didn't, that mother would still assume that her daughter is a Jehovah's Witness as well, which prevents them from doing blood transfusions. So that would mean, since she's only 13 years old, the mother still has custody over her daughter medically, so she makes the ultimate decision. But since they're both unconscious, it's best to assume that you cannot deliver a blood transfusion to either of them.
Okay.
Although you might as well keep them alive until they regain consciousness.
You don't have that luxury of time. Okay, go ahead.
I agree with everything she said. The only question I have is, you mentioned earlier that there's an option for bloodless transfusion. So is that something that we can opt for in this scenario, or are we thinking of a time period before this was available?
So there are blood substitutes, but in this case, because it's a car accident and they're bleeding massively, the surgeon has essentially minutes to make that decision. Go ahead.
Okay. So me and some of my friends kind of talked about this, and like I'm grappling with this decision myself, but I want to be a pediatric cardiothoracic surgeon. So like this is something that could like definitely happen. And honestly, if there's like two people about to die in front of me, I think that I would give them the transfusion anyway. And like I would honestly give my license and like everything just to make sure that like two people are kept alive.
Oh, okay. Guys, we need to let people talk. Go ahead.
Okay, so personally, I think that, I mean, obviously, I know that the daughter is probably a Jehovah's Witness as well, but I think I would give it to the daughter only, because I think that the mother, as a grown woman, has chosen her faith and knows that this is like this is like what will happen if she needs a blood transfusion. She can't get one. She chose this and she kept it, and so she knows that this might happen. Her daughter is young, and I don't think, I mean, I know she's still under the custody of her mother, but personally I think I would give it only to the daughter.
Okay.
Yeah.
All right. One last in the back, and then we're going to give you the answer. So we will try to help you understand. You wanted to say something too? Okay.
So I agree. I think that there's a valid argument to be made that the daughter at 13, that's a very young age to be certain about your faith and have enough knowledge to fully comprehend that decision. And also, I don't know the exact details, but I don't think that there was any document that said that the daughter was Jehovah's Witness. So I think that with all of those circumstances combined, I would give the blood to the daughter and not the mother, because the mother has made that decision.
Okay. So these are inspired by real cases, and this has happened here in New York City. I won't name the hospital. And both of them were transfused blood because they were unconscious. No one can verify the validity of the document. And if you do not transfuse and the mother says, oh, I kept it, I forgot to remove it, I changed religion, or the husband come to tell you something like that, you would be in trouble. So the fact that they're unconscious means that they do not have capacity. You cannot verify the information. But here is the problem with Jehovah's Witness. No, this is something serious. This is something serious. If you give them blood transfusion against their will, and they know that, and their community knows that, they will be outcast. So, and that's the reason I'm not inviting you to laugh. This is something really serious. You may not view that as important, but if I'm an Orthodox Jew living in Borough Park, you cut me from that community. You cut my lifeline. I don't know how to go and live in any other neighborhood. So that's an important aspect. If you are outcast, ostracized, it's a big deal for these people for generations. So that's the reason. More importantly, it is also their firm belief that if they receive blood transfusion, they're going to go to hell. They are not going to be saved. So that's the reason it is important. However, what a lot of people don't know, and I can tell you, some of your parents who are here, who are physicians and nurses and others, they may not know either. And that's the reason some of you should consider going into a career of bioethics. Is if you transfuse a Jehovah's Witness who is unconscious and she didn't give you permission, it is okay. Their community will not outcast them because they did not participate. It wasn't free will. I gave that lecture to a bunch of ICU docs. None of them knew that aspect. So that is something that is extremely important. So you cannot. So the point you made, it's not about your license. And you may choose what you consider to be valuable. But if I tell you, I do not want to have your surgery, and I'm conscious, you cannot force me to have the surgery. It would be considered battery. You could go, not only you would lose your license, but you would go to jail. So that's the reason it is important. What you argued was right, except that the reasoning was a bit different. We're going to move
Just
forward because
one question, Louis,
yes.
at the microphone.
So
Yeah.
recently there was a picture that circulated the internet with a guy who was unconscious and had a tattoo,
Yes.
DNR on the chest. So would this rule apply to that case also because he's unconscious and there's no way to verify whether he does not want to be resuscitated?
So I struggle with putting that on the thing, but I said, there are a bunch of young kids, and I didn't want to talk about death. So that's the reason I didn't put it, but that's good. So yes, that patient, by the way, did get intubated and did receive care. And what they did, they called an ethics consult, and they tried to gather as many people as possible to verify that the DNR that was tattooed on his chest was real. And really, because it could have been, I have a friend of mine who is an attending physician in the ICU. And whenever I said that, she hates me. But I'm going to say it anyway. Her name is Deborah Nina Raouf. It could have been Deborah Nina Raouf.
Right.
Okay? So that's the reason so you have to err on the side of caution and on the side of life. Yes, Nessa? So scenario 2, we're going to go a little bit faster now. Same patient.
The mother is awake and tells the surgeons that she and her daughter are Jehovah's Witness. She declined both transfusions for herself and her daughter in accordance with her religious beliefs. Should the surgeons respect her wishes and give no blood, ignore the mother's refusal, and transfuse both patients, transfuse only the daughter? And I think those questions have been answered in one way.
So you guys understand that? So here, you have to transfuse the daughter. Because one of you, two of you, in fact, three of you argued that the daughter didn't have a choice. For example, your parents may be Jehovah's Witnesses, but when you grow up, you choose to be an atheist. So your parents may be Christian. When you grow up, you decide to essentially practice Islam. Just because your parents are one religion doesn't mean that you're going to be in that religion. And we're going to go back to that case again. Third scenario.
So the mother is awake and tells the surgeons in front of her husband that she does not want blood for herself and her daughter. So the new person in is the husband. Husband disagrees with the wife's refusal of blood products. What should the surgeons do? Talk to the patient alone, ignore the patient's refusal, and transfuse blood, honor the patient's request.
So we have somebody here. So here you have two parents, one saying give blood, one saying don't give blood. What do we do?
Should I speak right now? Okay.
Guys.
So in this situation, are we considering that there's two patients involved?
Yes, the mother and the
daughter?
daughter. They're bleeding profusely, and we need to take them to the operating room in the next 15 minutes.
So the husband's a non-factor.
The husband is there. Somebody called him and he rushed to the hospital and he said, oh yes, I was getting a blood test at Memorial when my wife was crossing York Avenue and got hit.
I think the husband's opinion might be considered for the case of the daughter, but not for the mother.
Okay.
And also, you would probably want to prioritize the patient's like decision over anybody that's like outside.
Okay.
Like,
Agreed. You wanted to say something? I'm sorry.
If I was a doctor, I would probably give the patient something for the pain, and then when they were relaxing and passed out while they were doing something for the pain, I believe in that case the husband would have power to say do the blood transfusion because they're not conscious.
I am taking the mic away from him. So you know that doctors have been sued for doing CPR on a patient who said, I do not want CPR. Okay? So it is real. These things happen. So we're going to move forward. So in this case, when you have two parents disagreeing, the mother can decide for herself, and we will not give blood transfusion, but she cannot decide for the daughter. You would have to go with the parents who says yes to transfusion. So that's the answer to that. There is a caveat here, however.
So if there are two parents who disagree, the default is to go towards life.
Yeah.
So that's how that's sorted out.
So let's go to why this is important. It's because the mother had capacity. The mother is an adult, has autonomy, can express her values and preferences, can assess benefits, indication, risk, complication, alternative. The 13-year-old daughter may not be able to do so, even if she's conscious. And Nessa, you want to talk about the caveats?
Yeah, so the parental authority is not absolute. There's a sliding scale so that the less serious the decision, the more likelihood whatever the parents want, you're going to go along with. But the more serious the decision, like this blood transfusion, then it becomes different. Very importantly, children should not be viewed as chattel, so that you have your own rights, you're individual human beings. But obviously, the parents in 99% of the situations really want to do what's best for you. So tremendous attention and authority is given to the parents. But when it's a life and death matter, then it becomes, medical decisions become very much part of that decision making. Louis?
So parents' Patriot doctrine is something that some of you, and perhaps even your parents, may not have been born in that case. I think it was in the 1940s in Massachusetts, where there was, in fact, believe it or not, it was a Jehovah's Witness mother who took a 9-year-old and gave her pamphlets so that she can preach to the community, and the kid was out of school. And the police officer saw that and told the kid, how come you're not out of school? And the kid said, my mother asked me to do this. So the police officer went to the domicile and arrested the mother, and they told the mother, the kid has to be in school. You can choose to be a Jehovah's Witness. But that kid's, the state has what they call, in legal terms, legitimate interest for that kid to be given every opportunity to prosper intellectually, physically, emotionally. And that's where that doctrine comes from. And that's the reason also if you have children that are being abused because the mother is a drug addict, for example, and doesn't feed them, then they're going to remove them. So there is something called child's protective services, CPS. In fact, they also exist for adults because you have a lot of growing population in America who are elderly and they suffer from dementia. So it is not just for children, it is for any vulnerable group. You have children or adults, they are born with mental defect or deficit, or they might have been involved in a car accident and they become paralyzed, or they got traumatic brain injury and they cannot function the way they used to be anymore. So all of these people, they are going to be protected by the state. And if somebody has their guardianship and doesn't fulfill that role, parents' Patriot is what allows the state to intervene. And they can refer the case to Child Protective Services or Adult Protective Services. And then finally, when somebody cannot consent, even if that person is a Jehovah's Witness and you cannot verify that, you need to emergently transfuse them. And then, as I said earlier, there are no consequences from the community of Jehovah's Witnesses because of that. We're going to do 2 cases after that.
So your 17-year-old sister was hit by a 50-year-old drunk driver while driving home and is now in a coma. The drunk driver was sent to jail for 5 years. The parents decided to stop life support 2 years later and donate their child's organs. The drunk driver is out on parole, sober, waiting for a liver transplant.
So
should he get it?
Should he get it from that daughter, by the way? Okay, guys, we're going to do the last case as well. Nessa?
Right, so think about this. This is for you to think about. This is your homework. Case 3, you are sick and admitted to the hospital with a rare form of heart disease. Your parents instruct your physicians and nurses not to tell you about your condition. Suppose you ask your healthcare teams about your diagnosis. The nurse comes into the room at night and you say, "What's wrong with me? I want to know what's wrong with me." What should the nurse do?
Okay, guys, those last 2 cases, you are going to take them home with you and you can debate them. And if you have any suggestions or any questions, feel free to send an email to ofd@mskcc.org.
We will be sending you a survey, and that will have our email address, and we would love to hear your thoughts about these cases.
So to finish, we have 2 more slides. I wanted to play that one for you.
Truth-telling in pediatric patients. It can be difficult to discuss illness in the best of times, but it can be a particular struggle when the conversation is about or with a pediatric cancer patient. Clinicians might find themselves reviewing truth-telling guidelines about how to communicate with a patient and their parents or guardian about a diagnosis, treatment, prognosis, and other medical information. From the start, it's important to remember that for patients under 18, parents have the authority to make decisions about treatment. Parents even decide how much information is relayed or given to the patient. Clinicians can help by providing education and guidance and encouraging frequent communication and consultation with parents and the patient. Clinicians must remember that every person in that treatment relationship could have a different opinion about what to say, how to say it, and how much to say. The decision to disclose information remains with the parents of an underage patient. Some parents might limit bad medical news because they fear it might cause their child to lose hope and hinder recovery. Or they might limit information for cultural reasons or because of a specific family dynamic. In some cases, children prefer less information. Alternately, some parents will want to share news with their child themselves in the way they believe is best. It is the legal authority, as well as the values and beliefs, that empower parents, and only parents or guardians, that gives them the right to choose what to say and when to say it. Many factors will influence a parent's decision about truth-telling, including the family dynamic, the child or adolescent's cognitive readiness and development level, the family's cultural background or religion, and other reasons. It is important to remember that these can be difficult decisions, and there might not always be agreement between the parents and clinicians, or parents and other family members. At any time, a member of the care team might feel that they've come to an impasse. Should that happen, it is helpful to review strategies to support disclosure, no matter the degree, and strategies that facilitate shared decision-making. Strategies for breaking an impasse can include verbally normalizing a parent's wish to protect their child, clarifying the benefits as well as the concerns surrounding disclosure, offering to help find the words or review ways information can be shared so that it is appropriate to the developmental level of the patient, and always remember to validate each person's perspectives and feelings. There are no right decisions because no consensus exists on these issues. That being said, there are institutions, including the International Society of Pediatric Oncology, that recommend sharing, not withholding, information, but always in a way that is developmentally appropriate. Also, there are resources and trained specialists who can offer another voice, another perspective, and help. They include social workers, child life specialists, psychiatrists, and psychologists. If there is still no resolution in the search for the least harmful, most beneficial path, it may be useful to request an ethics consultation. Ethics may also be able to assist if parents cannot agree with each other, or if the parent's decision causes a member of the care team to feel moral distress.
I wanted to conclude with that last slide. If there is one thing that you need to take home with you today, is that bioethics is sometimes a matter of perspective. So through my many travels, I just came across something that I consider to be excellent street art. I was in Athens with my wife, and we were walking, and I saw this. And she said, "This is ugly. Why are you taking that picture?" And I finished taking it, and I took the second picture, and here is what it is. Thank you.
Thank you all.